Okay, guys, this is Dr. T, and welcome to Clinical Medicine with Dr. T. So, guys, with me I have got to Akhona. Akhona is my colleague. She's a pharmacist. So, guys, I'm so grateful that she has finally agreed to come and teach us and coach us, guys. So, the reason why I called her, I think she's going to assist us a call. She's got a role in terms of giving us insight into a legit prescription. There's a big wall between doctors and pharmacists because sometimes us doctors are stubborn and our prescriptions are not legit, and so most of the time you find that you get these calls from the pharmacist asking you what did you prescribe and all of that, and it's so frustrating when you've got 100 other patients to see. You've got like a long queue, and now you've got to explain to the pharmacist why did I prescribe this, why did I prescribe it the way I did, and all of that. So I'm gonna ask her to help us with that. Hi, Akhona.
Hi. Hi, everyone. Hi, Dr. T.
Okay. Hi, Akhona. So what is the most frustrating thing when you've got to dispense scripts from doctors? Like the biggest frustration?
I wouldn't call it frustration because it's part of our job. We're a group of people who know that yours is to make sure that everything goes right. So when something is wrong, it's not frustrating. It's just something that you would prefer for the prescriber to know. So first, top of the list is you prefer for the prescriber to write in legible writing. But I say it's not frustrating because we understand that the list of people that you have to see in a day is long and you get tired. We get that, but if it's legible, it works. But when it's not, we tend to get used to doctors' handwritings and we forge on. There's that. And then we would prefer that the doctor checks the patient's weight against their doses, checks the patient's history against the doses, gives a proper diagnosis against a proper prescription, so that when it comes to you, you're able to look and quickly also check that, okay, this is what's going on here, and this is what I'm supposed to give, and this is the level at which I'm supposed to give it, and this is for how long I'm supposed to give it. So you know all of that based on the doctor clearly explaining everything and doing everything in the order that I just mentioned. And then there's also how doctors are supposed to write a schedule 0 to 4 script in a certain way and a 5 to 6 script in a certain way. So 5 and 6, you're supposed to write it, especially 6, you're supposed to write it in number and in word. I can't have that script in my records. And I can't keep it if it's not written properly, because if I get audited by whatever authorities I have, it's an illegal script, and the medication you're prescribing is very important, and it's quite, it can be toxic or whatever the case may be. You need that document to support you. So if the doctor has written illegibly, they haven't written out properly, they haven't written out all the patient's details, you might get into trouble for that. And litigations are one of the biggest problems at the moment. So there's that, and then it's a long list of things.
I'm glad you mentioned litigations because many of us, when I say us, I mean doctors, many of us, we think that the pharmacist must dispense whatever that we have prescribed. And
sorry to interrupt you. There's one that I completely forgot this one. It's a must. We would prefer that the doctor uses current treatment guidelines, not to the T. Yes, because some of them are specialists and some of them are consulting specialists, and so they might flex a bit on it. But when we have treatment guidelines, I don't know, some might think, I don't know what the assumption is, but they're well researched and they've been put out there for a reason.
And you guys, do have guidelines?
Yes, we do.
In pharmacy?
Yes, we do. So we check those, and then we tend to literally place them on top of the script and see how well you match against them. So that would be mostly TB, HIV, and I think those are the most common ones that have guidelines and we follow to the T. So, yeah.
Okay, no, thank you for that. So guys, what I was saying is that I want her to tell us what is the danger of her actually dispensing medication that she doesn't really agree with, or doses that are not really correct. Because as far as I know, it doesn't only get back to the doctor, but they also get in trouble.
By the way, as a pharmacist, I can choose to not dispense your script. So, in most cases, we just cancel ourselves out of the situation and hope for the best. But in cases where you get caught, firstly, there's the South African Pharmacy Council, and those ones, yeah.
They don't play. They don't play.
It goes as far as losing your license, unfortunately. But in most of the cases that I've seen, it's getting fined a lot of money.
So guys, what I want you guys to really get from this is that, like she said, they are not obliged to dispense your scripts that are not really, if they don't agree with it, and it's not, if the doses are wrong, and if you have not followed the guidelines, and they can see that what you have prescribed is just away from the norm, they put a right not to dispense your medication. Another thing that I wanted to ask her is that, let's say a patient got a wrong medication or a wrong dose. If the patient comes back and they actually investigate, and then they find that Dr. So and so wrote a wrong prescription, it won't only end with that doctor, but they'll come to the pharmacist and ask, why did you dispense this medication? You saw that something is off, but you still dispense. So that's how they get into trouble. So when I started working, I used to get frustrated being called by a pharmacist. But in the long run, I got to understand that it's also to help me, to assist me, not to get in trouble. So we have become friends because she does. Guys, there's a pharmacist that I used to work with. That lady would actually physically come to my consultation room. What she does, we're on WhatsApp, so she sends me whatever. If she can't see whatever that I wrote, she'll send that. That's the communication that we have. I don't know. One of you I want to ask, what are I believe there are 10 steps to a legal prescription. What are the things that a script has to have in order for it to be legal? And there's a difference between legal and legible, right? Mm-hmm. Yeah. So, do you know? I think you know the 10 steps.
Okay, I didn't know that they call it 10 steps.
Okay.
So maybe it's a medicine thing, but in pharmacy you just know that there's a type for everything. So there's a type of script for 5 and 6, like I mentioned. 5 and 6, you write out the word and the full name, the full name and number, whatever you're writing out. And so if I start with that type of script, 5 and 6, the top has your address and your cell phone number, contact details, your practice number, and it has a date, clear date, and it has an age, and it has the details of the patient, age, weight, and address, and then you write out everything in the exact way that you want it, in word and in numerical, okay, in numbers. And then right at the bottom, you write, you sign, and then you write out your name or your practice number again in pen, okay, and then you write the date under your signature. Mm. So that's for the higher scheduled drugs, and then. But that would also depend on context because, like I mentioned, there's an address at the top, your address and your telephone number. But you're of course not going to do that in our situation in a government hospital where you already you're a known prescriber in this hospital. We have your contact details, we have your number, we know where you live, so we don't need to go that far. But if it comes up on the patient's file, the patient's details are on the outside of the folder. So on the inside, all we need from you is the date, the details of the patient, that this is what's happening with the patient, and this is the age, and this is the weight, and then you write out in full detail what you're writing. You sign at the bottom, you give me your practice number, you give me the date that you saw the patient on, or the date that you wrote the script up on. You're not supposed to make a copy, and you're not supposed to give me a copy, and you're not supposed to give me repeats on that script. It's written once. and it's only 1 month, and then the following month if the patient is coming again, they have to write up another one, and we are supposed to keep record of that script so that if we ever have to follow up on anything or if we ever get audited, we have records of, okay, this is the patient that we see for Schedule 6, and these are the scripts that we've been taking for all of the months that we've been seeing them. So you can't give me a 6-month long one. And for a 0 to 4, it's the same. Patient's details, clearly stipulated the address, cell phone number, age, weight, and all of the other things that you guys check out before you evaluate the patient. And then what it's supposed to have is the name of the medication, the dose, the route, the frequency, and the duration. Can be repeated, and it depends on what you and the patient end up deciding on together, or as the prescriber. And at the bottom, you sign or you stamp and you write out your practice number.
Okay, so how important is the diagnosis?
Very important. It's very
because
important.
you know, some doctors will be like, I've written a prescription. They're pharmacists, so they just have to dispense, and I don't have to tell them the diagnosis. So how important is the diagnosis when you are dispensing a prescription?
I like working with the younger generation doctors because I don't know, for some reason I've seen a difference between the older ones and the younger ones. That the older ones, they just seem to have this different perception of pharmacy. So I guess with time, you guys are getting introduced to what we do. I'm not sure, but it's less difficult with younger doctors. You guys know that you are dealing with a person who knows a bit more than just take them, give the patient, and then let them go. I need the diagnosis in order for me to be able to maybe help you with what we have. For instance, I spoke about the context where you're prescribing. You're prescribing in a government hospital and you need some things that we might not have. Yeah.
One other thing I wanted to ask me, as a doctor, let's say I'm in town and I want medication, maybe for myself or for a relative. Can I write on a piece of paper and put my NP number and have someone in town, a pharmacist in town, dispense that medication?
Piece of paper with all of the details that I've just mentioned.
I put my name is there, my NP number is there, and all of that. But there's no address.
Oh no.
You can't.
It's exactly the way we had said, right at the top, a beautiful piece of address with contact details and everything that I'm going to be able to trace you on. And also you must be known to the local pharmacist because sometimes you're gonna get to Manas or somewhere random and you think I'm a doctor, I can just you get there and the pharmacist will look at the script and will think, I don't know this person and I don't want to get into trouble with issuing out scripts that might turn out to be from just around the corner, someone just trying to get drugs. So they might use caution on that and just refuse your scripts.
Okay.
So unless then you've got all of the details and they are also ones who are also, let's say, diligent enough to search for you and find out where is this empty number practicing, is it, who is it, and then if they find your details on, is it HPSA? Or whatever portal you guys have that releases details of who you are and where you work. If they find you there, then they will issue out your script. But for as long as they don't know you, they're likely to refuse your scripts.
So they've got the right to refuse.
So
do you guys have a right to refuse dispensing a script simply because there's no diagnosis?
Diagnosis is always supposed to be there in a legal script. So let's just call it illegal for you to not put a diagnosis.
Okay, so it's illegal.
So if it's illegal, the pharmacist is not going to do it.
Okay. So do you have anything that you want to add? Maybe you don't want to call them frustrations, but I know there are frustrations because you get frustrated. Because instead, now you spend time calling me, wanting to find out what was I trying to write here, and that also takes a bit of your time. So what are the other things that maybe just frustrate you in general that I didn't ask about?
Teamwork and getting recognized for your work is something that pharmacists appreciate a lot, because we, as you had asked before, we tend to be those people who are just expected or thought of as people who are supposed to just give medication, but there's a lot that you as a doctor or you as a person who's prescribing can get out of working with the pharmacy. If you work with the pharmacy, you will move in strides towards your goals for your patient. So if there's anything that I think you guys should know about, is that if you work with every type of discipline in a humble way and in a way that seems to want to progress, and you listen, that's also something else. You listen and you be patient, then you will get far with whatever goals you have for your patient.
Exactly. So guys, we need to, as doctors, we need to just be humble and agree that in medical school we're never taught how to prescribe. I remember there was an exercise on how to prescribe, but that exercise, when we were doing, I think we were doing 4th year, it lasted for less than 30 minutes. I think they don't emphasize prescribing enough in medical school. That's why I decided to get her to just help us with that. So guys, I'm gonna ask you, if you've got any questions, just put, just type them on the comment section. I'm gonna have her answer those questions again. Are we good? Bye guys.